Principal Secretary, Health and Family Welfare Department Sampat Kumar said that the department has received good suggestions from the public and civil societies on the draft Meghalaya State Mental Health Policy. He said that the draft is now being finalized and will be placed before the cabinet soon.
You all aware the state has brought state health policy in 2021, and thereafter state is really working very focused way. What are the important elements? For example, how to improve maternal and child health. A lot of focus is given. The state government also brought Chief Minister's Safe Motherhood Scheme, especially to give additional support to the high-risk pregnant mothers, to save their lives. In fact, that we could see the results also. There is a lot of support and a lot of people. The uptake is there. Earlier, our institutional deliveries used to be about 50%. Now it has gone to 62%. So today we had a review with all the districts. So there is a significant improvement is happening because we have a policy, and we articulated that we need to increase the lifespan of the people of Meghalaya. So that to facilitate that, when you require to work on it at a different levels, one, you need to focus a lot on preventive measures, not only the curative measures. Mostly our efforts used to be the curative measures. Now we need to talk a lot about the preventive measures. For example, tobacco is something that is a consumption that has to be reduced. Now about 10,000 schools actually we have identified, and where they've been made as a tobacco free educational institutions. So this is, again, we have an app that monitors whether anybody is selling tobacco near the schools or not. So a lot of that preventive measures are also very important when we wanted to address the cancer or any other disease. So these things are happening. Similarly, maternal and child related things, you need a lot of awareness about immunization uptake has to increase. If your immunization uptake increases, automatically a lot of reduction would happen. These are all the preventive measures. Immunization is a preventive measure. State also has brought early childhood development mission. Idea is that that's the period where the brain of the children grows fully. So the plasticity, they call neuroplasticity. The neuroplasticity is really good during that period, and also during the adolescent period. So we are focusing on that early childhood period, so that the children's the cognitive capacity, their entire executive functioning skills will improve significantly, so that their school readiness would be very good. So their when they go to the schools, their participation in the schools, their learning outcomes would be significantly very high. So these are the steps that are being taken as part of that implementation of the state health policy.
Responding to a query regarding the health department's preparedness to deal with the ongoing pandemic in view of election rallies, Principal Secretary, Health and Family Welfare Department Sampat Kumar opined that the public by this stage are now fully aware of how to handle COVID-19.
Generally, this elections is a subject matter of Election Commission of India. There are already a particular set of standard operating procedures are there, so we'll follow them. Yeah, and as I said, we do have we do actually have all those measures, like all those whatever the guidelines, and we definitely, I think now I think it's a time now where citizens are aware of what are their responsibilities, and they also know a lot about the COVID, what how to deal with it. Suppose if somebody is having COVID like symptoms, so they naturally they are protecting themselves from their own family members. So there is a kind of a more of a it has become a more like a I would say an endemic kind of a disease, in the sense like where how to handle. Suppose if you get a fever, how actually families would handle. So now actually a stage has come where people should able to handle in such way. There is a lot of efforts are being done by the education department, and the schools, and the deputy commissioners are doing that. When it's going on, it's an ongoing exercise. But as I mentioned, like if you ask me whether are we putting a drive on that one, the way actually, because now that we are in a position where actually we can see, and how actually things are happening, accordingly we will take measures, because we need to take a calibrated measures. We can't do things or push things in such a way that which would actually cause unnecessary anxiety.
On immunization of children for various diseases, the Principal Secretary said that vaccines are being provided at village level every month.
This again regarding child immunization, this was a very important parameter, because through immunization we can prevent a lot of infant and child deaths. Because so for example, I'll give an example of one case somewhere, it happened in Garo Hills, where some few children died of diarrhea. So when we went to see that one, those children have not taken the vaccination, which is actually, it's called rotavirus. There is a vaccine which actually prevents diarrhea. So vaccination prevents a lot of such diseases. So there are different kinds of vaccines, almost like 20 different vaccines are given during the first 1 year period of time to the child. So when they're born, there are certain vaccines are given, like BCG, and all these vaccines are very, very important, because if those vaccines are taken, if they are prevented from other because that's where actually we could able to bring down a lot of diseases, like right from measles to smallpox and so many other diseases that we could able to bring down because of this vaccination program. So coming to do the vaccination, so there was again we state has put in a serious effort on that one to really sensitize, understand. Now the vaccines are provided at the village level. Every month our vaccinator goes to the village on a particular date. Every month every village, almost like a 6,400 villages every month. Vaccinator is that ANMs carry the vaccination, and they give vaccine to all the children. Basically they have a list like which child should get what vaccine. So that exercise we are monitoring very closely. Earlier it used to be about 54%, now it has become 91%, so it's almost like a doubled. So it's the reason is that, like, providing the services to the doorstep of the people.